Joining us here for the first time is Eveth Green, RN and Assistant Vice President of Nursing at Advantage Care Physicians. Thank you so much for being with us here this Friday night.
Thank you so much for having me.
So we've been talking a lot, as you know, about this newfound connection between COVID-19 and kids, it seems, on that pediatric multi-system inflammatory syndrome. There's now 110 cases here in New York City. We did have one death in the Bronx, a 5-year-old little boy. And it seems from the new information that we got today from the mayor that Bronx kids are being impacted the most here with 37% of the cases, Brooklyn with 20%. Just wanted to obviously open it up to you. Have you seen any of these cases so far, and what are we learning about it? What do parents need to know?
So, thank you for having me. I work for Advantage Care Physicians. We have about 38 locations all across the Metro New York area, and in our population we do have pediatrics as well. And so what I would really say to parents is, as we've learned about the COVID-19 earlier on, it really didn't affect kids as much. They were not the population that everyone was sort of looking at. But as we can see, weeks now in, that this is now something that's coming up in our pediatric population. COVID-19, as you can see, is changing very rapidly over the weeks and almost day by day. So for parents out there, just monitor those symptoms. If your child has a fever, abdominal pain, all of those symptoms that have been listed, that you make sure that you're calling your pediatrician. Early detection and early treatment is really the best option for kids right now.
And really, just if you have any questions, we've learned throughout this whole time. I mean, the second you feel anything different with your body, I feel like the switch is made and you make that call. So that's another great reminder there. Thank you so much for that. I know we already have some callers on the line, so obviously want to get to that. Busy Friday night here on the show. Let's get to Ethel, who is in Kensington. Ethel, can you hear us?
Yes.
What is your question tonight?
Okay. We're 4 friends, ranging in age from 70 to 90. We have been sheltered in place for the last month. Would it be safe to play outdoors a card game called Canasta if we would wear masks and gloves?
So, hi Ethel, thank you for your question. If I heard your question correctly, you've been sheltered in place, and now that the weather is getting nice, you would like to go outside?
Play cards outside at a bridge table. We would be upstate New York.
So, Ethel, I would recommend that before you do, you really talk to your primary care provider before venturing out. And if you do, and you know that you are going to be around other individuals, you definitely would need to wear a mask. But I would make sure that you speak to your primary care provider to make sure that it's safe for you to go out based on any underlying conditions that you may have.
Great question, though, Ethel. I mean, especially with the weather being so beautiful today, it's going to be beautiful tomorrow. So good question. I know a lot of people have that on their mind, but really important to make that call to your doctor and just talk about everything before making a decision like that. Let's get to Richard, who I know is on the line in East Tremont. Richard, how are you?
I am fine. I'm fine.
Good. Good to hear from you. What's your question?
My question is to the doctor.
Mm-hmm.
I'm a diabetic type 2. And my question to you is, God forbid, because I had got into a seizure attack a couple of weeks ago. Now, the EMS had picked me up and sent me to the emergency room where it wasn't a pandemic. Now we have a pandemic. My question is, what is the chances, if I did went into this, what is the chances of me getting the coronavirus and I'm being treated in triage? What is the chances of me getting, is it safe for me to go into the hospital? Is my question to you, Doc.
So that's a great question, very great question. So wherever you go, whether it's in the hospital, out in the community, that you take precautions, right? You make sure that you're you wear a mask. The hospitals have really done a very good job of ensuring that patients are safe when they come to the hospital. So if you are sick and you require that emergency treatment, the likelihood of you staying home and having something serious happen to you, it's better that you go to the hospital if you have an emergency. There are many precautions that have been put in place to protect patients who are COVID and or non-COVID in the hospitals. So if you are feeling sick to the point where you're having like a difficulty breathing or any emergency situation, you do not want to stay home.
Good answer there, Richard. Great question as well, because a lot of people still have different appointments or maybe non-COVID related things that they need to head to the hospital for. So great things to keep in mind. But as you said, there have been so many precautions put in place at really every hospital, every medical care center since this whole thing started. So good to know as well. I know Renee is on the line in Parkchester. Renee?
Yes.
Isolation or before being off quarantine. So it's more about the symptoms than it is really how many days that they're sick. You want to make sure that for those 10 days that individual is symptom free and is without a fever for more than 72 hours. So we don't know the extent of how long the virus will be shedding, but based on those symptoms and those CDC guidelines. So if somebody remains symptomatic, you continue isolation. And if they're not, you follow those CDC guidelines to be off pause for quarantine.
Great point. And then even after that time, you know, it's still advised to be wearing a mask and things like that, obviously on the CDC website. So it's not, you know, going totally back to normal. It's kind of staying super cautious since there's a lot we still don't know, right?
Yes.
Yeah. All right. Thank
you. We have to make sure that we're always wearing our mask and washing our hands. Those are the things that we should continue to do.
Mm-hmm. Definitely, especially when we're all living in close quarters, you know, in one apartment, you know, so really and surfaces too. It's like I try to remind myself too to just like keep wiping down, you know, all the main surfaces in my apartment too. So Renee, great question. I'm sure she misses her dad so much, but really just kind of follow the guidelines. And thank you for calling in too to get that personal response too from our guest. So we have so many more callers on the way. We are going to get to all of your questions here, and we are going to be right back, so stay with us. Thank you so much again for giving us your time. We already have callers on the line, so I want to get to Edgar from Throgs Neck. Edgar, how are you?
I'm doing well. How are you?
We are good. Grateful to be here with you. What's your question?
So I have, my dad is a stage 4 stomach cancer patient, and he's on immunotherapy. He's been on it for about 3 years now. Mm-hmm. And he wants to know how long he needs to stay away from somebody who's recovered from COVID. My brother had it back in March. He recovered like mid-April, and we still are keeping away from him. And are there any precautions that we should take if we do actually decide to meet?
That's a great question, and this is really a tough time to have to stay away from your loved ones, and we really understand. But for patients who are immunocompromised, we know that we have to be extremely careful because they are more susceptible to getting COVID-19. Again, I would recommend that, you know, speak with your dad's oncologist to see if it's possible for him to be around you know, other individuals. But as far as gathering, we just want to always remember, whether you're walking outside or you're with your loved ones at home, always remember to wash your hands and really make sure that you're wiping down those surfaces and, you know, keeping that social distance when you go outside. So those are all the recommendations that the CDC has put as guidelines for us to follow. So if and when you do decide you go outside, make sure all of your family members are wearing a mask when they go outside. The weather is beautiful, and now I know it's very tempting to be outside, but during this time we really cannot forget those important rules that we need to follow. So as the city becomes, sort of we begin to unpause, I know that people are eager to go outside. So we just have to make sure that you're following the guidelines. You're wearing your mask, you're doing your social distancing, you're not touching your face and touching your eyes, and you're really washing your hands.
Edgar,
and I hope your dad feels better soon.
Definitely. Dad, and glad your brother has gotten through it, COVID, at least for now. So thank you, Edgar, for calling in. Hope everything works out and you all continue to stay as healthy as possible. Tamara, let's get to Tamara, who's in Concourse in the Bronx. Tamara, how are you?
I'm fine.
Good.
Now.
I know. For now, grateful. What is your question?
Okay, at the end of March, like the 29th, like the first day of, leading a week into April, I got really sick. First couple of days, I had a fever. Then I got better. Then it got worse. Couldn't smell, couldn't taste, couldn't do anything. So they tested me twice. Well, they tested me around like the 8th day, so I've come back negative 2 times. And so then I went back to work for a week, and then I had, real bad palpitations. So then they did chest EKG and found out I had pneumonia.
Oh, wow.
So then she tested me again. It came back negative, but then she gave me the antibody test, and it came back positive. And then the other half said negative. So does that mean that I actually have it? And when it comes to exposure through the blood work, how does that work? Because if this shows up in your blood, that means you actually had it, right? Because they say exposure. They don't really explain. They just give you your results and be like, okay. And do I still have to wear a mask when I go out, being that now I'm considered that I have it and immune?
A lot of questions there.
So they say.
Yeah, exactly. So they say, because I know there's still a lot of research being done to get that. Do we have the nurse back? Okay, sorry, we had a little bit of a technical difficulty there. Tamara, you might have to sum up your question again, because right in the middle of that, she did hear it.
I heard her.
Okay, great.
Okay.
I didn't know how long you were gone. Okay.
No, I heard all of it.
Thank you,
awesome. For the question. So this is a very great question. As we know, COVID-19 is really this mysterious virus that we're all seeing. And so we see patients who are asymptomatic, who have COVID, and then we see patients who are symptomatic and still test and are negative, come back negative. So we're still learning about how long the shedding occurs and really understanding some of those questions that you asked, right? Because as you can see, COVID-19 it changes week by week, day by day. So I would continue to follow up with your primary care provider and really make sure that those symptoms that you have subsided before you do come off isolation. And if you do go outside, and I'm going to say this over and over, make sure you wear your mask, make sure that you are doing those hand hygienes. And we also have to remember that this is a time where there's a lot of allergies around, and you can feel like you have the flu or you have COVID. So that's why it's really important. At Advantage Care Physicians, we are so aware of that fact. So we have implemented a lot of virtual visits so that for questions like these, where people are uncertain whether I have allergies or whether it may be COVID, that they have someone that they can connect with virtually and get those questions answered.
Great advice. Tamara, thanks for calling in. Let's quickly get to Josh, who's on the line in East New York. Josh, what's your question?
Hi, I have a question today. My son is 5 years old and he gets visitation rights. So I don't know if it's safe to take him to his father's house because of COVID. I don't know if they're sick.
Yeah.
I'm sorry, there's a lot of background noise. I wasn't able to hear the question.
I said my son is 5 years old. He gets visitation rights. So I don't know if it's safe to take him because I don't know who's sick and who's not sick.
Okay.
So
we're coming to
we're
getting to the end of the block here, Josh. So we're going to check on this question in the commercial break and then answer it real quick when we come back. So continue listening because we're just get cut off in like 9 seconds. So Josh, hang on. We're going to answer right when we get back. So stay with us, everyone.
Now that we've seen what's happening with children and COVID, it's even more important now to make sure that we are really being vigilant and taking extra precautions when we're taking care of our children. So both parties need to come to an agreement. If one party is sick, you do follow the guidelines. You make sure that you isolate yourself. If you are sick, try not to be around the child, and if you are around if you're not sick, then just make sure that you're following those guidelines. But it's important that both individuals come to have that conversation to ensure the safety of both them and the child that they're taking care of.
Amazing. Thank you again for summing that up. And we again spoke with Josh about it during the break. I do want to get to this because this hasn't happened on the show yet. We had another caller, and it was not a question. It was your sister. Cousin Beverly, who called in, who lives in the Bronx, and she just wanted to call in saying she's so proud of you, Nurse Green, saying that she was watching, I guess. So just so cute. It made me smile. Hope it's making you smile too. So thank you so much for being with us here and answering all of our viewers' questions.